sir, one of the most common mistakes that I hear from my students when I ask them, see, a patient comes to you with wrist drop, and I ask them, what is the probable site of injury in the upper limb? And many of them tell me that the site of injury is probably below the elbow, which is obviously wrong. So, can you please explain this?
See, we have to understand that radial nerve is coming from axilla, going behind the humerus, and then here at front of the lateral epicondyle, they give two branches, one cutaneous for the dorsum of the hand, other is the motor nerve. So if you say below elbow, you're mostly talking about posterior interosseous nerve injury, entrapment injury, and it is a pure motor nerve. So it'll be compromising some of the posterior forearm muscles, extensor muscles, especially there'll be a finger drop at the MCP joint, but not wrist drop. Why not? There'll be weakness, but there'll be no wrist drop because there is a powerful wrist extensor which is called as ECRL, extensor carpus radial longus, already supplied by main trunk of radial nerve. So, if there is an injury below the elbow, that means posterior interosseous nerve is gone. There are 2 points. Point number one, it will be a pure motor problem, no sensory loss, because the posterior interosseous nerve is a motor nerve, and it will be just finger drop at the MCD. If you have a wrist drop, that means the injury was more proximal, maybe fracture midshaft humerus, or maybe some axilla, crutch palsy, and all that. Because then only the branch to ECRL will be compromised. The muscle, which is a powerful wrist extensor, so will definitely give you wrist drop. That is above elbow, not elbow.